Good afternoon and welcome to Seminole County's COVID update. Here we've many of you have just heard the governor speak and outline his guidance for the state as its entirety. Hopefully you all had a chance to watch that and understand what that means. Our emergency management group has been monitoring that every waking moment, and we're going to roll out some guidelines that'll be in line with that today and help Seminole County understand where we're at. I think it's important to thank the citizens of Seminole County that for their vigilance in observing the social distance orders. It should be noted that Seminole County has never closed a business, nor was it ever our intention to close a business. That said, we will continue to adhere to federal and state guidelines, which many of you again heard what the governor just outlined. Our hospitals here in Seminole County have never been overwhelmed. We've increased availability for free testing countywide. We've had adequate PPE for our medical first responders, our firefighters, and our first responders in the law enforcement realm. Our executive policy group, which consists of Seminole County Board of County Commission Chairman, that's me, Jay Zembower, Seminole County Sheriff Dennis Lima, Seminole County's Medical Director, Todd Husty, Florida Department of Health Representative Donna Walsh, as well as Seminole County Manager Nicole Guillet, as well as Alan Harris, which is a frequent face here in these times of this health crisis and all these press conferences. As well, it should be noted that our plans will align with the state and federal guidelines as we begin to look at how best to open businesses. To reiterate the government's plan for those who have not had the opportunity to review that or see the press conference, schools will remain in distance learning, no visitors to senior living centers. Elective surgery can return statewide provided the hospitals can provide ample space in the event of any kind of outbreak for capacity. Also, as well as they can provide their own PPE, they will be allowed to do those elective surgeries. Outdoor seating will be allowed at restaurants with a 6-foot space between tables and a 25% capacity indoors. Retail can operate at 25% capacity. No changes for bars, gyms, and personal services such as hairdressers still remain closed per Governor DeSantis. Vulnerable populations should avoid close contact with people outside the home. All individuals when in public should maximize physical distance from each other. Avoid socializing in groups larger than more than 10 people, and circumstances don't allow that, then protective covering for your face is recommended. Face masks are always recommended in any face-to-face interaction. Where you can't social distance, our social distancing for reopening order will take this step a bit further. We'll have Alan Harris further explain that in just a second. I also want to speak directly to the business community. I will be looking at anything and everything at the county level. We know the businesses are hurting that can't open, and we now know under the governor's new order, some of them still can't open. We know a lot of people are out of work. So I will be looking directly at any fees or anything that we can waive in the way of red tape at the county level to assist the small businesses getting back up to speed and back in business when that time arrives and when that time comes. We will also be looking at any fees that may be able to be looked at from a statutorial standpoint that we may be able to waive for regular citizens and some of those permitting fees and so forth. Basically, we want to promote being able to be a partner with our small business people and our local community to get people back on their feet. Likewise, we will continue to look to the federal government as well as the state government for any grants that may be able to help these businesses, as well as we continue to communicate about the lack of ability to get your unemployment benefits. So we continue to work on that aspect. I've spoken to all the constitutional officers in the county, asked them as well as our staff to look at, we're going to be in an economic downturn and we need to look at areas we're going to cut. So Seminole County is going to make cuts as necessary as we get into this economic downturn. A lot of you are beginning to see numbers, and keep in mind, those numbers are only a 2-week trend based on the way it's reported. So when those numbers come out next month, I think a lot of people are going to be shocked how many people are actually out of work. I saw a status the other day that 50% of those that are able to work in the United States will not any longer be working. that's pretty significant. So we need to do whatever we can here at a local level to help those people get back on their feet. So with that said, I'll turn it over to Alan Harris, who will give you more detail on Seminole County's new ordinance.
Thank you, Chairman. As the Chairman mentioned, the Executive Policy Group has met 4 times. It's important to note also all of the cities met again this afternoon in anticipation of what the Governor would release. And we've had over 4 phone calls with conference calls with the city managers and the county coordinating our response to whatever the Governor would issue. In addition, our Economic Development Department has been coordinating with the small businesses in Seminole County, as well as the chambers. There are multiple chambers here in Seminole County. We've been working with those chambers of commerces to help any small business or large business as much as possible. As the Chairman mentioned, none of our executive orders ever closed any businesses. None of the executive orders even remotely said anything like that. It was strictly social distancing. So we required social distancing. We required 6 feet distance in between employees and patrons. We were one of the first counties in the state of Florida to have markings on the floor at checkout lines and queue lines, because that was a requirement of ours, as well as limited occupancy. So in concert with what the Governor distributed this afternoon, Seminole County has modified our executive orders. Our executive order continues to be social distancing. It continues to encourage/require employees and patrons to be 6 feet apart. That is consistent with what the Governor has mentioned. We are now allowing employees and patrons that work within 6 feet to do things. Now, of course, his executive order and his instructions were for some of those businesses not to open, like hair salons and things like that. But for any of the other businesses where employees and patrons need to be within 6 feet, our executive order allows that. We are requiring face masks or face coverings for those types of industries. So you are now in Seminole County, of course, allowed to employee and patrons work together within 6 feet, just wearing the mask and face coverings, and that was, of course, consistent with what the Governor mentioned. As well as the past 2 executive orders did list that no group should be 10 or more in business meetings, trainings, and workshops. That will remain consistent. We are going to modify our occupancy level to 25%, consistent with what the Governor has stated. And then again, the checkpoints, we are still requiring the checkpoints at checkout lines and at queue lines outside of the store, which is very consistent with what the Governor had mentioned. And as I said before, we had required that with our first executive orders many weeks ago. And again, we were one of the few counties, the only county that I know of in the state of Florida that had markings on the floor before other counties and then before required by the state of Florida. Our executive order for places of assembly has been removed. This will supersede that places of assembly, so that means that certain places of assembly, now the Governor did mention that movie theaters cannot open, but churches, if they wish to open at 25% occupancy, absolutely, we are allowing that with the new executive order. So that I know will help some of our faith organizations. We've been talking to multiple faith leaders across across the county, and we are happy to be able to provide that to them. A lot of those, of course, have gone to online services and drive-up services, and of course that is still very, very safe, obviously, way to do things, and if they wish to continue to do those types of activities, they can do that. This now gives them another option to minister to their congregations in this in a very difficult, challenging time. The Governor mentioned a step-by-step approach to bringing the county and the state back to normalcy, so I'd like to go over some of those. The first thing that he mentioned was to protect the vulnerable, and I think it's very important that everyone knows that weekly we have conference calls with ALF and nursing home administrators, daily with anyone that has a COVID-19 patient inside of their facility, as well as information and regular communication has been sent to homebound seniors through our partners with Meals on Wheels. Increased testing was the second step And we have increased testing across Seminole County. Pop-up sites in low-income and vulnerable communities has taken place, as well as the 2 drive-up sites. And I want to thank True Health, our nonprofit medical partner that has helped with the pop-up sites. And we have 3 additional sites for next week scheduled on Monday, Tuesday, and Wednesday. Monday being in the Oviedo area, Tuesday in the Sanford area, and then Wednesday in Lincoln Heights. And unfortunately, Lincoln Heights had to be canceled for tomorrow because of expected severe weather. So we have increased testing across Seminole County. The third step was to promote social distancing, and again, we were one of the first counties in the state of Florida to require floor markings on to checkout lines and to queue lines to demonstrate social distancing protocols and to require no groups of 10 or more in meetings and trainings and workshops. The fourth step was to support hospitals and healthcare workers, and we continue to provide personal protective equipment to assisted living facilities, nursing homes, and hospitals. To date, we have passed out over 251,000 masks to assisted living facilities, nursing homes, and hospitals, over 43,150 gowns and face shields, and over 105,700 gloves. So a lot of equipment coming here to the logistics staging area, which is just near our facility here, and then being sent out to the assisted living facilities, nursing homes, and hospitals for our healthcare workers on the front line. And of course, the fifth step is really his step at the state level, and that is to prevent introduction from outside of the state, so we will rely on the state of Florida, of course, to handle that. With that, I'd like to turn it over to Donna Walsh, our health officer.
Thank you, Alan, and good afternoon. As was explained with the governor's press conference and his announcement of the approach of reopening Florida, it is a safe, smart, and step-by-step approach, as you've heard from both the chairman and Alan. The priority areas, as Alan just mentioned, I'll include a couple others, is public health and safety. We have learned even more so than what we knew about the importance of public health and safety in our communities. Protecting those vulnerable populations, as was mentioned, the long-term care facilities, and even our senior groups within our communities. Also those with underlying health conditions, which we have mentioned many times. Preparing our healthcare systems, and the governor did announce that currently the state of Florida has almost 75% ventilators available in our hospital systems, and 36.5% ICU beds available. There have been 2,111 hospitalizations reported thus far during this event, and in Seminole County, 81 hospitalizations related to this event. And so we feel, at this point, we certainly have the capacity to take care of those who are ill from this virus. Protecting civil liberties and rights. This was another priority that the governor covered on his press conference. And making sure we maintain public confidence. It's important. He did spend a good deal of time of fact versus fiction, if you will. What the projections have been over time, and because our community has been very vigilant in following and adhering to the guidelines set forth by CDC and other professionals, we have been able to really reduce what was projected as the number of cases that would spread throughout our community. Also, partnering with our local community. We could not do this alone. Not any of us could do this alone, and we have amazing partners here in Seminole County, True Health being one of those, Advent Health with the pop-up testing, all of our hospital partners. I mean, the list could go on and on. The county and all of their support, the health department could not do what we do without the county's support. Since the pop-up testing started in our disadvantaged areas throughout the community, we have tested over 2,000, and our positivity rate last week was about 8.4%. We're down to 5.6%. So we are seeing a decline, just as a lot of the counties, or I would say the majority of counties, looking at each of the counties on the dashboard, the majority of counties in the state of Florida has seen a decline in the positivity rate. That's a good direction to be going in. And so there's certainly encouraging information out there. We we, in this gradual step-by-step process, know that we just can't open everything up because, we could experience a setback. So it's so important that we continue to be vigilant, as we say every time we meet, and to make sure that we adhere to those social distancing practices while we're gradually opening back up, so that we will reduce the number of cases that are being spread throughout this county as well as the state. Every day throughout the state, there are additional reports of cases as well as additional reports of deaths. So we don't have zero yet, and we want to get to that point soon. But it's going to take all of us, working together. And so I would say, just as I do every time that you invite me up here, is to please maintain your vigilance in helping each other prevent the spread of this virus, and we can all make it through together. Thank you so much.
Thank you, Donna, and thank you, Alan, and thank the news media for being here to help get out the message. We're going to go to our Hispanic translation here in just a moment. I can't say enough about how grateful we are and how blessed we are here in Seminole County for our business community who has taken an unfortunate hit of nothing of their own doings. Again, we're going to, at the local level, do everything we can to cut whatever red tape, see what fees we may be able to roll back to help you people get back on your feet. The small businessman is who drives this community. I'm very thankful that you've been understanding and patient through this unfortunate situation as we really focus on protecting the community as a whole. That includes your patrons, the community officials, and everybody that goes along throughout our community and those coming and going in our community as well. Without you, we all would not be here. Many of our people wouldn't have jobs, so we're very sensitive to allowing our small business people to eventually get back on their feet. As the governor continues to monitor and give us updates, we will continue to do that as well. So again, I appreciate that very much, and we'll now go to questions.
Real quick, obviously, your amendment to your executive order to align yourself, this all starts Monday, right?
Correct.
Okay, so churches can't necessarily follow the new rules this Sunday. Secondly, and I know that throughout all this, I've noticed it's been a health emergency, but it's also been one math equation after another, so I'll give you this. So 25% capacity, if you're a large church or you are a large restaurant and you're 25% capacity, you're going to have more than 10 people in there. How does that work?
Yeah, so Alan will address that if he needs to, but I think the governor has outlined that 25% capacity, but no close proximity of 10 people or more in any gathering. A single family can sit at the same table, but other patrons cannot.
Okay.
So they'd have to be spread.
I happen to know a particular restaurant that has seating for 300.
Sure.
When it was going to be 50% capacity, that was going to be a problem for them because they were going to have 150 people in there, and the rule was 10.
That's right.
Now, if the rule is 75, can they have 75 people in there?
I would think so. I mean, that's what we're interpreting from the governor's orders. Absolutely.
So as long as immediate families are together, but strangers are kept 6 feet apart,
Correct.
You can go past the 10.
That's correct.
And that's true of churches, restaurants, or
Understood. Yes, that is correct.
The question about houses of worship, it says in exceptions that they're not going to be held to the same rules that's listed out for other businesses. So does that mean that churches can just have the gatherings they would without social distancing?
Well, I think that for the most part, what we're going to rely upon is what the governor has outlined, number one, and what we've heard from our faith-based leaders are they really don't have an interest in getting their people infected with any kind of virus. So many of them are going to actually deploy their own type of social distancing. We've heard everything from groups of 10 separated apart. We've heard different parts of the church. They'll hold the service virtually as well as remotely, virtually, and continue to do so.
So it's not mandated, but it seems like these churches are taking it upon themselves to
Correct.
put social distancing.
Absolutely. I think most of it, for the most part, is based on taking that small step a little bit at a time, and while we continue to ramp up testing and monitoring the community to understand if there is going to be an uptick, we're on it very quickly. And I think that's the overall goal for a lot of these recommendations in the governor's new order.
To that point, are there phases here in Seminole County when it comes to reopening? Like, are we going to revisit some of these percentages in the next couple of weeks?
So good question, absolutely. So we're bound to do whatever the governor hands down. He's already told us there's going to be a phasing in, so we'll be forced to follow that same phasing in. So as those new orders come down from the governor, we'll adopt those as well.
Ellen, if you could step up there a moment, please.
Yes.
I have a question for you.
Yes.
Were you disappointed at all to hear that some businesses like hair salons that have been opened in other states are still not able to open up here in Florida? Because like you mentioned, a lot of people, small businesses, and there are definitely a lot of those here in Seminole County.
So certainly. So, on a personal note, as a small businessman myself, I'm extremely disappointed that some businesses will continue to suffer. I trust the medical experts. If it is their belief and their understanding, their direction that this is not safe currently, then I will default to their best judgment. Anytime, we have a situation, unfortunately, in this health crisis where there's been a force to choose who can be in business and who can't. That's very unfortunate. But I think that's just the aspect of that particular profession and how that could spread the virus. So we will continue to watch that. We're hopeful that we can get to the next phase and the governor can give us recommendations to open up all businesses. Absolutely.
So obviously, so many people have pent-up desire to go out and have a relaxation of the rules. This is obviously going to be a relaxation of the rules. Please, if you could put into words how concerned you are that people don't go beyond what the rules are going to allow. And we're already hearing that some parts of the world are already seeing a second wave because of rules being relaxed. Why is it important for people to follow these guidelines?
So we have seen the flattening of the curve because people are not being exposed. It's hard to get the virus if you're not exposed to the virus, right? So people have been social distancing. People have been following the guidelines of CDC and the World Health Organization and the White House medical team. They have been doing the right things in Seminole County for the most part. There are a few pockets here and there of calls where the sheriff's office and the local law enforcement had to go out, but those are very, very small, extremely small. So we have seen the flattening of the curve because of that. If people continue to do what they've been doing, with these new businesses opening up, which is wonderful for these new businesses, I think we can continue the flattening of the curve. And I know a lot of people want to get right back. There's going to be a new norm. This is a new norm now, and hopefully there'll be a vaccine soon, and hopefully we will be able to get back to normal. But until then, we are going to have to continue to practice these social distancing because we've gotten where we are because of that. You've seen other places in the country where they did not do these things, and you saw what the results were. Even in our own state, as the governor mentioned, where large groups were still having large parties on the beaches, well, you're seeing the results from that. And here in Seminole County, we had at the very, very beginning of this recommended, and people did follow the social distancing.
Seminole County allows people to get tested even if they don't have symptoms. How important is it for people to do that?
Well, the health department and emergency management got together and we talked about if we wanted to require symptomology or we wanted to just allow people to get tested. And we thought it was very important for everyone to get tested because individuals may be asymptomatic. So sometimes it's just peace of mind, right? You've heard about this virus for so long, you just want to know, so we're allowing anyone and everyone to get tested if they want to get a test. So, we quite frankly didn't know what the response would be. We didn't know if people would want to even get tested. If they feel well, why, we're not sure if they wanted to get tested. Well, we learned very quickly on the first day that people wanted to get tested. And since then, every day has been full at each one of the sites, and that's why we're continuing.
This executive order just applies to businesses that the governor is allowing to open on May 4th.
Any businesses here in Seminole County. Yeah.
I have a question for Chairman Zembower.
Sure.
The red tape that you talk about, is there any timetable for when you want to have a list of fees that you'll
Certainly. So I've asked staff, and they're starting looking. They've begun looking at this as of last week, and hopefully we have some information by the first of next week. A list of things that we're not bound statutorily to be unable to adjust. We want to look at all those capabilities of moving red tape out of the way, looking at the fee structure so we can help people get back on their feet. You know, to the point, to mirror what's been said many times, and I know I said it in the last press conference, a lot of this is not only to be safe, but we understand that a good portion of our community, and business leaders and business owners need to understand this as well, there's going to be a significant amount of people in our community, in all communities, that even if they could come to your restaurant or come to your place of business, they need to feel safe. And so it's your responsibility as a business operator and a business owner to make sure you structure your business so those patrons coming to your place of business not only are safe, but they feel safe. If they don't feel safe, they're just not coming. So I think that's very important that our business community, now that you're able, most of them to open up, and you heard me speak last week about get ready, start looking at your business, see how social distancing looks. For those that still aren't able to open, I would urge you to continue to have the thought process of not only being safe, but you convey to your clientele that you want them to be safe when they come to do business with you. So with that said, again, I thank everybody for being here. We're going to turn it over to our Hispanic translation. Thank you all very much for being here today.
Muy buenas tardes. En resumen, primeramente habló el señor Zembower, y como mencionó, todos han podido posiblemente ver la conferencia de prensa del gobernador. Estamos muy orgullosos de todos los residentes y queremos pues que se mantenga la vigilancia en cuanto a esta condición y se siga observando el distanciamiento social y las órdenes que han sido ejecutadas, y muchas personas lo han estado haciendo, así que muchísimas gracias por ello. Aunque seguimos viendo casos positivos, pero sí hemos seguido las guías establecidas. Los hospitales pues al momento pues no se han visto sobrecargados en el condado Seminole. También ha visto un aumento en las pruebas que se están realizando a través del condado. Tenemos adecuada protección personal para el personal de salud pública y de salud en los hospitales. Estamos preparados para proteger al personal laboral también, como lo expresó él. Y el grupo de póliza ejecutiva del condado Seminole, que incluye pues el presidente de la Junta de Comisionados, que es el señor Zembower, así como el director médico del condado, el sheriff del condado Seminole, también el oficial de salud pública, Donna Walsh, el director médico, Dr. Husty, y también el manejador de emergencia, Alan Harris, así como líderes de la comunidad del condado y de la ciudad, pues han estado colaborando grandemente pues en crear un plan para abrir los negocios. Y eso es de lo que se ha estado hablando en esta conferencia de prensa. Los planes pues se alinean con las guías federales y del estado para asegurar que los residentes y los negocios estén todos listos para poder abrir de manera segura. Para reiterar y repasar el plan del gobernador, pues se mencionó que las escuelas permanecerán con el aprendizaje a distancia, como se ha estado haciendo. Los centros de cuidado de personas mayores o ancianos, pues no van a estar recibiendo visitantes. Los hospitales podrán comenzar con las cirugías electivas. También los restaurantes podrán sentar o operar a 25% de su capacidad dentro del restaurante y al aire libre, instituyendo los 100 pies de distancia o de espacio entre las mesas. También las tiendas podrán operar a un 25% de capacidad. No hay cambios para las barras, gimnasios y servicios personales como son los salones de belleza, ya que permanecerán cerrados por el gobernador, así como el gobernador lo ha expresado. Las poblaciones vulnerables deben evitar contacto directo con personas fuera de su hogar. Los individuos, cuando están en público, deben utilizar el distanciamiento social también. Evite socializar en grupos de más de 10 personas en circunstancias donde no sea posible el distanciamiento social. También es muy recomendable utilizar las máscaras de protección y cuando esté a proximidad con personas, ¿verdad? De persona a persona en contacto, y también cuando usted no puede hacer el distanciamiento social. Sabemos que los negocios están siendo afectados y muchas personas están sin trabajo. Sepa que se hará todo lo posible para aliviar y que los negocios puedan regresar y las personas puedan comenzar a estar nuevamente de pie, ya que hay muchas personas pues sin trabajo. El condado Seminole también hará recortes según sea necesario, ya que la economía pues se está viendo afectada. El manejador de emergencias, Alan Harris, habló sobre el grupo de póliza que se ha reunido pues ya 4 veces, trabajando con las cámaras de comercio. También el condado se ha mantenido para ayudar a los negocios y a los negocios pequeños. En el condado Seminole nunca se cerraron los negocios, solo se requería el distanciamiento social. Y la orden ejecutiva del condado Seminole pues ha sido modificada. De ahora, y de acuerdo pues a lo que el gobernador ha mencionado, los restaurantes operarán a 25% de capacidad, utilizando también los 6 pies de distancia entre las mesas. Las personas que trabajan en negocios o los negocios que trabajan con personas y clientes que trabajan a menos de 6 pies de distancia, pues pueden hacerlo, pueden trabajar. O sea, eso va a estar abierto ahora para que puedan trabajar, pero sí se les requerirá máscaras mientras trabajan en esos lugares. No más de 10 personas pueden estar juntas. También las tiendas pues deben marcar sus pisos como se han estado haciendo por cada 6 pies. Los lugares de asamblea, que incluye varias cosas, entre ellas las iglesias, los cines, pues los cines permanecerán cerrados, así como el gobernador lo indicó. Y las iglesias podrán abrir a un 25% de capacidad y manteniendo también el distanciamiento social. Muchas de las iglesias están haciendo servicios por internet y reuniéndose a través de los carros, o sea, los drive-thru, o drive-in podría decir, pero pueden seguir haciendo estas medidas, pero también pueden reunirse a un 25% de capacidad. El gobernador mencionó un plan paso a paso para abrir, que incluye pues proteger la población vulnerable, hacer llamadas con lugares de cuidado de ancianos, o sea, constantemente estamos llamando y verificando estos lugares para que las personas mayores pues estén bien y puedan ser atendidas en sus necesidades. Se han estado haciendo los aumentos de prueba y ya los hemos estado haciendo, como lo han visto aquí en el condado Seminole, gracias a True Health, y durante la próxima semana también habrá muchos otros lugares donde se estarán haciendo las pruebas para cada persona que así lo desee. Se promueve el distanciamiento social. También se han apoyado a los hospitales y al personal de cuidado de salud, dándole pues sus mascarillas y equipos de protección personal. El condado ha dado 251,000 máscaras, 41,350 batas y 150,700 guantes para los centros de cuidado de personas mayores y para diferentes centros de cuidado de salud. La oficial de Salud Pública, Donna Walsh, habló de nuevo sobre lo que el gobernador explicó, que es el Safe Smart y Safe by Safe plan que tiene, que incluye, además de las prioridades que se mencionaron anteriormente por el manejador de emergencias, también incluye pues la salud pública, el proteger la población vulnerable y personas con condiciones de salud que los hacen propensos a complicaciones. Que queremos mantener la confianza de la población, queremos que ustedes sepan que estamos ahí, las agencias gubernamentales para ustedes. Colaborar con agencias de la comunidad, tenemos muy buenos colaboradores como son True Health, los hospitales y otros que pues si los mencionamos pues estaríamos aquí mucho tiempo. Hemos hecho ya, o sea, True Health en las pruebas pop-up ha hecho 1,775 pruebas hasta el momento. Y la tasa de positividad pues ha estado disminuyendo. Queremos enfatizar que las cosas, los negocios no se deben abrir muy rápidamente, ¿verdad? Y queremos pues mantener esas guías que se han estado llevando a cabo de distanciamiento social para que todos pues podamos seguir estando bien y eliminar la cantidad de personas pues que se están contagiando.
Thank you to Myrna Chamorro for doing the translation in Spanish for us today. We sincerely appreciate it. We're very proud of our Hispanic community here in Seminole County and those that continue to help us get the message out, so we sincerely appreciate that very much. Again, on behalf of the Commission here in Seminole County and the 7 cities, as well as all the folks here in Seminole County, thank you very much for attending today's press conference. Be well.